I'd also like to have Steve Sanders, someone who's not new to the political process, and he's from Agencies for Children's Therapy Services, to say a few words. Steve?
This is not my speech. Thank you very much, Senator Tkacyzk and Assemblywoman Fahey, for sponsoring this very important legislation, and my good friends, Senator Latimer and Aileen Gunther, I think may have left. She's in the back. There's a lot of momentum growing in the legislature as a result of the testimony you've heard today from providers across the state as to why the early intervention system, which used to be the flagship program in the country for 20 years, has now failed to deliver on its promise for the last 6 months. I know a little bit something about this issue since when I was in the Assembly for 28 years, before I became the executive director of the organization called ACTS, which is an amalgam of associations and entities that provide early intervention services around the state. Before I became executive director of that organization, while I was in the Assembly for a number of years, I was the sponsor, along with Assemblyman Gottfried and then Assemblyman Alan Hevesy, of the original legislation authorizing early intervention in New York State. It worked. It worked for 20 years. And how refreshing was it for you, I know it was for me, to hear Senator Tkacyzk say, "We screwed up." Wouldn't it be nice if we heard those words coming out of Washington, D.C.? Perhaps that impasse might be a little closer to becoming resolved. But with all the good intentions in the world, when the legislature passed a law 2 years ago relieving counties of their administrative burden to process these claims, because, as every speaker has said, it ought to be the responsibility of commercial insurance to step up to the plate and pay their fair share, it has not worked. When I was on my way to the office this morning, I was listening to the local radio station, and there was a report about a particular federal employee who had been furloughed 7 days ago, and how difficult it is for that particular federal employee to make ends meet, to pay the bills, to pay the mortgage, to pay the medicine. For 2 months, in April and May, not a single provider was paid for services already rendered. For 8 long weeks, no providers were paid. And 6 months later, the bills are still backed up. Months and months and months, they are backed up. The cost to providers for doing what they're supposed to do for Bella, for youngsters just starting out in life, has been seriously jeopardized because, as every person has stated correctly, so much time now is being spent dealing with billing, chasing down commercial insurance, trying to get paid for services that were rendered months and months before, and that's not why they got into the business of early intervention. They got into the business of early intervention to make sure that Bella had a better shot in life and was able to become the young girl, the young woman, and someone who would have a real future. It's been said already, but I think it deserves reinforcing. Early intervention is not a drain on state dollars. Lest anybody think, we have a lot of great programs in the state of New York, can't afford them all. Sure, maybe we have to do things that were good years ago, but we can't afford them now. Early intervention is one of those few programs in New York State where every single dollar invested in early intervention, every young child help, saves the state countless millions of dollars for avoided, much more expensive special education costs later on in their education career. It makes sense for Bella. It makes sense for the state. The question is, why did anybody really believe? Why did anybody really believe that when counties were paying providers and then trying to recover the dollars from commercial insurers, why did anyone believe that providers, individual providers or agencies, would have an easier time collecting money from commercial insurers who we know have always been resistant to paying what they're supposed to pay? If they are expert on one thing, they are expert on avoiding their responsibilities to pay for programs that they ought to be paying for. And now the responsibility has fallen on these women and men and agencies across the state to try to get the money from commercial insurance so they can get paid that counties could not recover. Why did counties not any longer want to process these claims? Because it was costing them time, it was costing them money, they were unsuccessful, and now that entire burden has fallen on the shoulders of providers. When the legislature passed the changes in the law, George Latimer thought, and Eileen Gunther thought, because this was 2 years ago, it was before Assemblywoman Fahey or Senator Tkacyzk had arrived, but those who were in the legislature thought the fiscal agent that was going to be appointed was going to take care of the administrative burden and allow the agencies and the providers to do what they're trained to do and they do best. It hasn't worked out that way. And that is why the bill that the Senator and the Assemblywoman is sponsoring is vitally important. It will restore the balance. It will allow providers to do what they do best, help kids like Bella, and get them out of the business of having to chase down commercial insurance for payments that are illusory in any event. Commercial insurance pays 15% of every claim that they receive, on average. So we know they're not going to pay, and when they do pay, it's a pittance, and providers can't afford to wait for weeks and weeks and indeed months until somehow the process comes full circle and they can get paid for services that they provided months before. I am so grateful for the senators and the Assemblywomen who are in this room today and the others, including Dick Gottfried and Kemp Hannon, chairs of the Health Committee, who are recognizing this problem. But what you heard just before I came up here is so true. These providers cannot afford to wait more months and months and months for this system to be corrected. And more importantly, children like Bella can't afford to wait. Bella's only going to be 3 years old or 2 years old once. She can't wait another year for her services. We can't say, well, we'll fix it maybe a year from now or 6 months from now. She's only going to be this age once. And if we miss the opportunity to provide the services for her, she will lose out for the rest of her life, and we as a state will lose out for the rest of our lives, doing things that we ought to be doing as a state that we used to do so well. It's time to fix the system. Thank you very much.
Thank you, Steve. I wanted to note that Jennifer Snedeker from Greene County is here with her daughter Bella. And did you want to say anything?
Sure. I wasn't really planning, so I don't know if she'll let me start. Okay.
She's been very patient, I have to say.
She is. She's
awesome.
I hadn't really prepared anything because I didn't plan on speaking today, but Bella, who just turned 2 last week.
Can you say your name, please?
Jennifer Snedeker. Bella just turned 2 last week. She was diagnosed at 7 months old with chromosome 22 deletion, also known as 22q. She has had feeding difficulties since birth. She has actually stopped breathing 4 times on account of that, and I've had to provide first aid in order to revive her. And since April, she has gone through 4 providers for her speech and feeding. She's gone weeks and weeks without any services at all. In the last 3 weeks, we finally gotten to the point where she needs to be with her services 3 times a week with speech and 1 time a week with feeding therapy. In those 3 weeks, she has made huge progress. So I just wanted to thank you all for coming out and supporting this.
Thank you. I think you've heard from the providers, from parents, from Bella herself, and from the legislators. This is a problem we need to fix, and the sooner we fix it, the better. I want to thank everyone for coming, and if you have any questions, we're happy to answer from the press.
Senator, can you explain how your legislation is different from the previous system that was in place?
Yes. The previous system put the unfunded mandate from the counties onto the providers. Previously, as you heard, the providers, the counties would seek reimbursement from the insurance companies and Medicaid reimbursement. That's been shifted to the providers under the legislation we currently have. And we think we need to have a legislative fix. What the legislative fix does is put that reimbursement issue on the state. The state has the ability to contract with a fiscal agent, so the fiscal agent would seek the reimbursements. So the service provider would send their invoice to the state's fiscal agent, they would get reimbursed timely in 30 days, and the fiscal agent would then seek the reimbursements from the insurance companies and Medicaid and deal with all of that and allow the providers to do their business, which is provide early intervention services. So it takes what we see as a problem in the system of how we're getting money to the providers into the state to deal with it. We think that's a more efficient way to get these funds reimbursed.
So would counties be completely cut out as they are now? Do the counties have a role in your legislation?
The counties and the providers would support, the counties still have to sign off on the provision of services. And the counties and the providers still have to get information to the state for reimbursement. But it takes that mandate that the counties complained about and puts it into the state's control. And the state has, a fiscal agent that deals with that reimbursement issue.
Senator, can I just ask something to make the answer more complete? What the senator and the assemblywoman and their colleagues are proposing is not a big change, but it's an important change. There already is a fiscal agent that has been appointed. The bills from the providers already go to the fiscal agent. What their bill critically does, and there's no additional cost to the counties. What their bill critically does is it says there's going to be a finite period of time that if after the fiscal agent receiving the bills from the provider and then doing what the fiscal agent does now, which is to communicate those bills either to Medicaid or commercial insurance, whoever ought to be paying, after a finite period of time, if commercial insurance or Medicaid has not paid, the fiscal agent, through an escrow account that is already set up, will pay the provider in a reliable period of time, 30 days. Nobody pays more money. The county doesn't pay more money. Ultimately, the fiscal agent is responsible for paying to providers whatever commercial insurance doesn't or whatever Medicaid doesn't. That's part of the current law now. Where the law has fallen apart is that it takes commercial insurance sometimes 2 months, 3 months, 4 months to process and adjudicate these claims, all the while providers not being paid anything. And ultimately, when commercial insurance does finally get around to paying, it's usually about 15% of the total claim. So what the senator is saying is that, by all means, let's send those bills to commercial insurance, but after a reasonable period of time, which the senator has determined, and I agree with her, is 30 days, if commercial insurance has not paid yet, then the escrow account, which is already set up and funded 50% by the counties and 50% by the state, the escrow account will pay the providers, so providers don't have to wait for months and months and months, and eventually the fiscal agent will reconcile with the commercial insurance companies what they are supposed to pay and ultimately will pay months later. It's really a small change. It's not a huge change in the law. It simply says that after 30 days, a provider has to be paid. The fiscal agent's already there, the escrow account is already there, it's already funded 50-50 by the county and the state. We can't allow providers to be out on the limb for 2-3 months without getting their reimbursement. So she makes sure, the two she's make sure that will happen after 30 days. It's a smart bill and it's the right bill.
Any other questions? Yes, Rick.
Two questions. This initiative, did this come from the legislature, or was this part of the governor's Medicaid redesign? And then part B, have the insurance companies, since this change began, are they doing anything different?
Well, this bill, the initial change came before I got here, so I can't tell you where the thought process came about, but clearly we think there needs to be a legislative fix.
Rick, it was separate from the Medicaid redesign. This was always a straight mandate relief measure to get the counties out from having to process and chase down commercial insurance. I think the governor in 2012 scored that as being worth a $6 million savings for the counties. The problem is that, as people expected, it's not the fiscal agent that is doing the administrative work. It is the individual providers and the agencies, and they're not equipped to do it.
And I think the insurance companies are confused too, and will challenge, and if the computer systems, from what we heard, isn't set up appropriately, they're getting misinformation and things are not getting corrected. So I think the system's just not working, and the insurance companies are confused as well. And I think we need to clean up the communication and have the role of what's getting paid when to really be in the hands of the state.
Senator, are you calling for a special session to deal with this?
I'd be happy to have a special session. I think this to me is a crisis. If we have to wait until January before this gets resolved, we're going to continue to see difficulty in getting services to children who need it. I would like to see a special session, not only for this, but a number of other reasons. We've got flooding issues in Fort Plain that I've spoken about. There's other issues that I think would be cleaned up in a session that's, we have sessions 6 months, and then we're on for 6 months. If we had 1 or 2 days in the fall where we could clean up some bills and deal with issues like this, I think that would serve the taxpayers and be a more efficient use of government.
Senator, you're saying you want almost a regular special session in the fall?
I think if we had a regular, in part of our calendar, if there are a few days in the fall where the legislature could come back and deal with some outstanding issues, I think that would be good for taxpayers in the state. I think that's just good government. Well, thank you all for coming, especially to Bella and her mom. Thank you. Thank you, Senator.